One of the contrasts of the southern Appalachian region is that it's a region rich in beauty, yet so many of its residents, especially its children, live in poverty.
Though they live in an advanced country, children throughout Appalachia often remain isolated in conditions similar to those found in the world's developing countries. At the beginning of the 1990s, more than 1/3 of all individuals living below the poverty line in Appalachia were under the age of 18. 40% of the roads in southern Appalachia are unpaved, and 12% of the region's families do not own cars.
Her name is Kyla Ashley Parker, and she came in with a bowel obstruction. And she's been in for about 36 days now. She's doing much better. They actually talked about letting us go home in a week to 10 days now, so she's doing much better.
Since opening in 1994, the Ruth and Billy Graham Children's Health Center in Asheville has accomplished an incredible track record of success in fulfilling its mission. It has developed and implemented a wide range of health services. In the last 5 years, the center has expanded from 1 to 25 pediatric subspecialties. Housed at Mission St. Joseph's Health System, the Graham Center consists of an inpatient pediatric unit, pediatric intensive care and neonatal intensive care units, physician practices and extensive outreach programs, and a wide range of physician subspecialties. With the exception of burns and open heart surgery, the center's physicians can treat all of the most serious conditions.
And until now, for people with cancer, people with children with difficult needs would have to be taken to Duke or taken to Charlotte or taken sometimes to Greenville. And this was hard on families, especially families from the poorer sections of Appalachia. Many of them don't even have transportation. Many of them don't have automobiles. They put a child at Duke and they can't even get down there to see this child. It also is a very difficult thing for that child to be away from his family and away from his home.
But the accomplishments at the Graham Children's Health Center have been achieved with modest resources to meet the needs of the children of the southern Appalachian region. For example, pediatric outpatient services are currently housed in this crowded 45-year-old building. The lack of resources is now limiting the mission of the Graham Children's Health Center. To continue with the development and implementation of these services, the children require a new building to house the current programs and to serve as a stimulus for innovative new services.
Us again. Not sure.
There we go.
We're excited about this particular growth of the Ruth and Billy Graham Children's Health Center. We feel that it fulfills the vision of what we're after to make sure that all of the children in our area get the kind of health care they need so that they can grow up and have healthy bodies. They can grow up and have clean, clear minds. And most importantly, they can grow up and have wonderfully open spirits.
But so many of these things can be done from an outpatient building. And this is what the great need is, because children don't always have to be hospitalized. Children can be treated in an outpatient building, come in the morning, go home in the afternoon and be with their families. And this is what we're trying to alleviate, not only the crowded space at the hospital, but that families can stay together, be together, and not have to go through the trauma of having a child in the hospital.
The vision of a new pediatric outpatient building has its roots dating back nearly a half-century ago. Then Dr. Nelson Bell, a medical missionary to China and father of Ruth Bell Graham, returned to the United States and established clinics to meet the health needs of children in and around Asheville. His daughter Ruth and her husband, the Reverend Billy Graham, continued Dr. Bell's legacy by establishing the Ruth and Billy Graham Children's Health Center. Today, their mission, based on excellence and respect for the needs of every child, continues and is expanding with the new pediatric outpatient center.
This center will be one of the finest in the southern part of the country. It will have the space to house all of the pediatric specialty care that we need to continue to provide care for children. It will be accessible. It will provide education. It will provide information about prevention of illnesses. And it will also provide the space needed and the opportunity for training and education for all of the specialty needs that are required to take care of even the most critical of children's health problems.
Though located in Asheville, the Graham Children's Health Center has established a reputation as a regional pediatric health care facility. Two of its most innovative programs have received national recognition. The Tooth Bus, a mobile dental unit, travels to schools in remote areas of western North Carolina to provide dental care and education to children from low-income families. Children receive regular dental care through the program throughout their elementary school years. And through Andy's Camps for Kids, children from around the Southeast who have diabetes, asthma, and cancer are enjoying all the fun of camp, meeting new friends who have the same health challenges and learning the latest about their diseases. Actress Andie MacDowell, who serves as the national spokesperson of the Ruth and Billy Graham Children's Health Center, enjoys seeing firsthand the many first-time experiences of the campers.
I wouldn't not want to participate and help children that were in need just because they weren't at my back door. The camps are taking in kids from all over, and we're expanding the programs as well, and would love to be able to have children coming from every state possible. But we're not just North Carolina. Kids are coming from, from out west, and they're coming from New York and a lot of different places. They're not just North Carolina kids.
One of the most significant challenges the Graham Children's Health Center has faced since its founding is this clear fact. The southern Appalachian region does not have the internal resources, especially financial resources, to bring about the health care changes needed in the lives of its children.
Let's lay Miss Shanna in the bed.
Southern Appalachia has special needs. And I think this is where the vision has come from Dr. Huff, because he was born in Appalachia and raised in Appalachia and came out of that, and he sees what can be done. And I think that we need to continue that vision.
We have great technology. We have improved medical care far greater than many of us ever dreamed could happen. And yet, many of those basic barriers still exist. The money to pay for care, the reimbursement for care, the access to it, the transportation to it, and the understanding of how to use it, all still are problems that we must face.
The dream of a new pediatric outpatient building has taken shape in its size, cost, and location. Through the generosity of a prominent Asheville family, prime land has been donated for the new center. The property is visible from Interstate 40, the main east-west highway through the southern Appalachian region, and is close to Interstate 26, the main north-south access to the region. Preliminary estimates indicate the cost of a 75,000 square foot building, fully equipped, will be $10 million. The goal of the Graham Children's Health Center Foundation is to raise those funds so that construction of this critically needed building can begin as quickly as possible.
We have an excellent medical center now. We have an excellent response to children's health care needs. We've modeled our program after that vision, I think, that Nelson Bell himself would wanted us to have done. And yet we have a long way to go. Nightfall's not here yet in that traditional journey of being able to finish your day and be at rest at home. And we have many, many things to do to develop this program. We have many, many things that are in front of us still to make sure that children are well, that they're safe, and that they're cared for where they ought to be, close to their home.
So what my grandfather was instrumental in starting, I think that the Graham Center is continuing. And me personally and my family, we are dedicated to not only seeing that it succeeds, but it excels.